This week on Real Talk with Denver7 and CPR News, is Colorado's legislation for doulas making a difference to maternal mortality?
When we're thinking about the mortality rate when it comes to Black women in this country, that is unfair.
We go back to find out what has changed since we last talked about maternal health care. Is this new law making things easier for families to access doula care?
Right now, we only have about 10 doulas that are approved for insurance.
Nonetheless, we're on the right track to making a difference for Black women in Colorado.
And what more needs to be done to truly save lives? Welcome to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Fernando Frescas. Each week, in a partnership between Denver7 and CPR, we have a real talk about issues impacting underrepresented people across Colorado.
And amplifying voices. We've talked before about the alarming statistic that Black mothers in Colorado are 3 times more likely to die from pregnancy-related complications than white mothers. That conversation highlighted systemic barriers to healthcare access for women of color.
We're following up on what's changed since our last discussion on maternal health care. This year, Colorado passed a new law to help address some of those barriers by offering access to doula services through health insurance. In theory, it gives mothers more control over their childbirth experience.
But how well is the program working? Are families able to access doula care under this new law? One issue is that doulas find it hard to get paid. Some doulas receive payments up to 9 months after providing services.
Now, under this new law, moms can choose to use doula services to complement their traditional healthcare services and have it covered by their medical insurance.
However, doulas and families say they're still struggling to access what they describe as life-saving care. So what is going on? Joining us now is Imani Williams, a doula and owner of Black in Birth. She specializes in birth and postpartum doula services. Imani, thank you so much for joining us for this Real Talk.
Thank you for having me. I really appreciate it.
Absolutely. So this new program came online in July. Can you walk us through how the program works? Do you have to register with insurers? And how has the process been so far?
Yeah, so basically there is an online registration that you go through and everybody signs up. Doulas sign up through that and you go through an application process and basically you wait. You wait until you get approved and then hopefully X amount of time later you get approved and you're able to be covered by insurance.
Now, in theory, this sounds like it works great. Is that happening in reality?
No, not at all.
No, not at all. Okay, well, why?
So there are a couple barriers that have made it pretty difficult, starting with the website itself. It's not a very user-friendly website. It makes it really difficult to even get to the application. The bigger issue that I would say that doulas are facing with this is we are having to go through a lot of hoops when we are not clinical providers. We are non-medical, and this process really treats us like we are medical providers. We need liability insurance, you need your tax EIN, and there's so many hoops, and it can be really expensive for doulas. On top of that, you need to be certified, and for a lot of doulas, that's not something that they originally planned on doing, and the certification process itself can take years and a lot of money.
With you saying you're a non-medical provider, it got me to thinking about what a doula is, just thinking about it from a cultural standpoint, from a holistic standpoint. And I have to ask you, Imani, why did you become a doula?
Yeah, so I became a doula because I started to learn a lot about Black maternal health. I have been really fortunate to experience really good health care. And when I started to really dig into, Black maternal health in the United States and in Colorado, the statistics are alarming. They're really terrifying. So many women of color are dying in childbirth and dying postpartum. And a big avenue to help improve those birth outcomes and postpartum outcomes is doula support. And we are there as advocates. We are there as emotional, physical, mental, educational support. I spend a lot of time with my clients really educating them. It allows for people to come into their births and be prepared.
And it seems there is this need and a desire for this to happen, but there also is running up against, the fact that there has to be kind of a formalization of the process, right? And so how do you as a doula kind of balance this now, because you are doing so much more than you used to just in terms
Yeah,
of paperwork?
absolutely. It's, I think, a big piece that really kind of lacked with this initiative was doula input. So much happened, and I feel like we're missing that doula piece. And going forward, I think it'd be really helpful to have doulas involved in this process, and then we would have a higher rate of doulas applying. Right now, we only have about 10 doulas that are approved for insurance, and we just had somebody be reimbursed for the first time. And it rolled out in July. A lot of doulas are really, kind of trying to decide, what do we want to do? Do we want to just offer sliding scale rates? That's what I personally do is, just make my rates flexible to the people in need. Some people just want to offer their services for free. And what can we do to make this accessible? How can we make going through these hoops easier so that we can really reach a wider network?
With your doula input, how would you change the current system? I guess, what are 3 things where you're like, if we did this, this, and this, this would make it more accessible for all of us?
At the very basics, we need to make this more user-friendly, period.
Okay.
It's just not. It's clicking 5 different buttons to finally get to the application, which takes a very long time to go through. We also need to really have, I think, the ability to get groups together, doulas together, and working on it together. It also needs to be, something that we make a little more affordable, whether that be, not having to require as many different pieces, or, not requiring only specific certifications, what that looks like.
But before I let you go, I have to ask you this, because I think this is a question we got a lot from our last episode. Is having a doula a luxury?
I strongly believe that having a doula is a necessity. The great thing about doula support is there is a doula for everybody. And with that, there are doulas that charge different rates and make it accessible for everybody. And that's really, really important. It's important to be able to, reach everybody and make it so that everybody does have that option. It is no longer a luxury. I think at one point it absolutely was. Now we're really seeing this for, all members of the community, and it should be accessible for all members of the community.
So say we have a family, a family of 4. I think the average here in Colorado is about $70,000 to $75,000 a year.
Yep.
This person who's giving birth comes to you and says, okay, I want to put together a birth plan.
Yes.
I need you during my birth.
Yep.
And I would love some doula care after birth for 4 weeks.
Of course.
What could you give us kind of a price point of what that would look like?
Yeah, so it definitely varies. It is a wide range. For birth support, I see anywhere from $500 for starting out new doulas to, $3,000. It really just kind of varies on experience. Everybody kind of sets their own rate, but postpartum support usually now runs anywhere from like $25 an hour to $45-50 an hour. With that all being said, I know for myself, and I know for other doulas that, are in the community, if somebody comes to me and says, I want doula support, this is not something that's financially feasible for me. I need the help, but I can't afford it. What can I do? There are ways to help with that, and so many of us are so passionate about this work that we really do try to work to make sure we can make it accessible for you and, make it affordable.
All right. Thank you so much, Imani.
Thank you, guys.
Imani Williams just spoke about the on-the-ground realities of the rollout of this essential program. And that aims to address high rates of maternal mortality. And it's been rocky. So how do we fix it?
So coming up, we'll speak with one of the bill's sponsors about what lawmakers are doing to address these challenges. This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Fernando Frescas.
And I'm Denver7's Micah Smith. We're having a real talk about the challenges families and doulas are experiencing with Colorado's new law that allows doula services to be covered under health insurance.
Now, the rollout of this program started in July. That's after a full year of consultation with health providers as well as advocates. One of the sponsors of this bill is Democratic Representative Junie Joseph, who joins us now. Representative Joseph, thank you so much for being here.
Thank you for having me.
So I want to start out with how this bill has a lot to it, right? Micah, what do you think?
Yeah, it includes a doula scholarship program to help provide financial support for new doulas and is designed to improve access to care. So can you talk to us a little bit about some of your thinking behind some of the bill's elements?
Yeah, thank you for that. I'm a first-term legislator, just finished my first term. When I started at the legislature, coming from Boulder, a community that cares deeply about diversity, equity, and inclusion. To me, when this bill came across my desk, I was extremely excited to be one of the sponsors. Again, when we're thinking about the mortality rate when it comes to Black women in this country, in a developed nation, that is unfair. And we need to do better. And this bill set out to do that better. And I heard earlier from Imani, who's a doula, and I heard some of the issues that we're facing. Nonetheless, we're on the right track to making a difference for Black women in Colorado.
I mean, what can you tell them about how to navigate this program? Is it simply just an education component that needs to get out there, or is there something deeper?
Yes, most certainly. We definitely need to do more work when it comes to education, but we cannot discount some of the comments that were made earlier by Imani, that the process itself, the regulations make it hard for doulas to do the work and provide the services that are needed. That also reminds me that I probably need to go back to the drawing board. I need to go back and have conversation with HICPUF. I also need to go back to the community and have conversation with Elephant Circle and a lot of the other groups who are doing the work on the ground. And more importantly, we need to have conversations with doulas. We've just heard only 10 doulas right now are able to take advantage of the bill. We need to go back and do more work to ensure that we have more doulas available and able to do this work, because ultimately it is women and women's lives who are on the chopping block.
Representative Joseph, it's not every day that we have an elected official admit that there are issues with their bill or issues with something that they've worked really hard on, but you seem very open to the feedback. Why is that?
Because that's the work. The work of governing is about learning and educating yourself and being in community with one another. I'm a legislator, and if we want to do better for our community and for the people, we have to be able to listen to their feedback. And I've heard feedback today.
But what's going right? There must be a benefit to this rolling out. We heard that this is a good first step. So from your eyes, going in the community, hearing about this, what's going well?
Yes. Yes, of course. There are things that are going well. As you've heard, there are a couple of community members and doulas who have taken advantage of the services. And that means there's 10 more than we had before. That's what's going well. Mm-hmm. And I do believe with education, we'll be able to get more young people and women and whoever else, men, involved into becoming doulas.
Yeah.
Is this personal for you?
Of course, this is very personal to me because I'm a Black woman and Black lives matter to me. And again, as well, another part of the conversation coming from Boulder and being a woman, as you know, Roe v. Wade was overturned, and we are at an inflection point in our society, in our culture as Americans. We want to protect abortion rights, but there's two parts to that right. Reproductive justice is two parts, right? Or reproductive rights. You want to give rights to access to abortion to women, but you also want to give them the opportunity to live and take care of their babies. And that's what I want to do as a legislator. I will fight for abortion rights, but I will also fight for reproductive justice.
Now, for moms who are watching or listening to this show right now and they want to have access to a doula, what's the first step and how do they find out more information?
That's one of the harder part of the work that we do as legislators. We pass these bills. Sometimes it's hard to know whether it's working on the ground. And that's often the work of the departments as well, to ensure that the information is disseminated out there to community members. I have a newsletter that have over 13,000 people. I do some of that work myself where I let community members know, hey, I've passed this bill. Here's how you can take advantage of it. But I think the department also have a lot of work to do. And also we rely on our nonprofit partners to help us in this work as well.
You mentioned Boulder being a very inclusive place and wanting to make sure that all feel welcome. I can't help but think about the cultural aspect of what a doula is. Can you talk about how doulas kind of further the work being done for Colorado to become more inclusive and more equitable?
Again, the idea is that we want women to have support. We want them to have a partner with them as they are giving birth. And that's the role of doulas. And we know, again, the disparities. How do we curtail those disparities? Is having an advocate with you in the room. And I believe with the support and the help of a doula, Black women and Hispanic women, and even white women as well. So again, it's having that support system to help women in a time when they are most in need.
All right. Thank you so much, Representative Junie Joseph, for joining us for this Real Talk.
Thank you. It's been a pleasure.
With so many challenges women face during childbirth, are we putting too much faith in a single program? What else needs to be done?
Yeah, we talked to an advocate who wants to see health institutions tackle systemic barriers to healthcare. Stay with us. This is Real Talk with Denver7 and CPR News.
Welcome back to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Fernando Frescas. We're talking about Colorado's new law for moms to have access to doulas. It's a way to tackle high rates of maternal mortality. But is it working?
Heather Thompson, Director of Research, Training, and Education at Elephant Circle, a Denver-based reproductive and birth justice organization, joins us now. We spoke with Elephant Circle during our last episode. And Heather, I'm so excited to have you back now that this law is in effect, because I want to know from your perspective, do you think the new law goes far enough? What does your research tell you?
Thanks for having me today. The new law is a great start. We love doulas at Elephant Circle. We say doula is a verb, and we love the community-based innate support that doulas offer. The program has had a few bumps, as you've heard. There's a bit of a gap between what doulas know about how to get signed up and what Medicaid members are expecting. So we applaud the department for really getting it up and running, and Elephant Circle has leaned in hard to make sure that both doulas and members can get matched up with each other.
Now, your organization has been campaigning for more midwives as well as doula services.
Yeah.
Why are you pushing the conversation away from doula provisions? Are there limitations of what doulas can achieve?
We know that the inequities that we're seeing right now are structurally based. So anything that is a systemic problem is going to require a multi-pronged solution. Doulas are certainly one piece of that solution. But as Imani mentioned, doulas are non-clinical providers, which means they're not actually disrupting the status quo. In contrast, midwives, who are used around the globe as part of the efforts to reduce maternal mortality, are not used in this country nearly as much, nor are they integrated into our traditional medical health system as much. So we really see doulas as a part of the solution and really want to push our systems to think about what disrupting that status quo with midwifery care would look like.
And I want to talk about what a midwife is. I think midwife is a word you hear throughout society, and you think you know what a midwife is, but you may not really know. So tell us, what is a midwife so we can differentiate from a doula?
That's a great question. So doulas are non-clinical providers. Midwives are clinicians. They've gone to school. They've been trained just like nurses and doctors are. The difference is that the midwife model of care sees pregnancy, birth, and postpartum as a normal part of physiologic processes. So a midwife is really looking to center the client and their family, center their strengths. It's very person-centered. It's very trauma-informed. And it's historically how people gave birth in this country before the early 1900s.
With that said, there is this multi-pronged approach. With this new law and this going into effect, are you lifting up one over the other? Is that a good thing? I mean, talk a little bit about that.
The law definitely lifts up doulas, and we're excited about that. Elephant Circle worries a little bit that it is a distraction because they don't disrupt the status quo. Because doulas exist outside the system and not within the system, they're fabulous support for families. And the system can, as we saw in COVID, if the system decides doulas are not going to be part of the care team, they can actually exclude them. Midwives are part of the care team, should be integrated into the medical system. And because they are clinicians, it allows them to hold a different lever of power. And truth be told, to increase midwifery in this country really would be disrupting the status quo.
I know we've talked a lot about a care team, and when we talk about a care team, my mind goes to a traditional medical setting. But I do want to talk a little bit about home births. I know a lot of moms who are interested in a home birth are almost scared of it a little bit because of some complications that can happen when you are at home. Would more midwifery mean more home births, and would this help reduce maternal mortality?
Well, what we know is that we're actually seeing the biggest efflux from hospital birth that we've seen in 50 years. More and more communities, specifically Black, Indigenous, and Brown communities, are choosing to birth outside of the hospital at home. I actually have a PhD in molecular biology and chose to give birth at home myself because it was a very scientific decision that fit my lifestyle and the fact that I was a low-risk, normal, healthy person. Around the globe, midwives care for normal, low-risk, healthy, physiologically normal folks. So in this country, we have people go see an OBGYN initially, and that person is a surgeon. That's where their training lies. And they actually are experts in non-normal, high risk. So having the expansion of midwifery allows people to choose what risk profile works for them, what kind of care team works for them, and an integrated system allows somebody to start giving birth at home, and if they need a different level of care, if they need an OBGYN or a hospital setting, that transfer is seamless.
With that said, do you think that, and this is just me leaning on my own understanding and my own experiences, do you think that there are certain stereotypes surrounding midwifery and doulas that has a lot of women maybe choosing or not choosing to go with that type of care? And what I mean is, if you watch TV, if you watch a movie, a mom is giving birth in a hospital. Even though you say more women are choosing to do home births, has that been a battle for Elephant Circle to combat some of those stereotypes?
Absolutely. The stereotypes are real and they're historic. Here in Colorado, the vast majority of people gave birth at home up until about 1925, 1930. And then by 1950s, almost everybody gave birth in a hospital. So we moved from a midwifery-led community-based model of care to an obstetrician-led facility-based model of care. And that process did require vilification of midwives. There was a regulation, and white male doctors wanted to move things into the hospitals, out of the home, and there was literally a process by which they denigrated midwives and made people feel less safe with them. So the fact that those are stereotypes now really go back to the last 100 years of history, and those stereotypes exist today very deeply.
I love hearing that people giving birth have so many options these days. Yeah. That alone, to me, shows and is an example of society moving in a more inclusive direction in terms of how we give birth. So, Heather Thompson with Elephant Circle, thank you so much for joining us for this Real Talk.
Thank you so much. And that is this week's episode of Real Talk with Denver7 and CPR News. Every week, we'll have a Real Talk on issues that impact Coloradans who are often overlooked.
You can find all of our shows on denver7.com/realtalk or at cpr.org/realtalk. Have a great day.